What is striking in this slide is that in the healthcare management and well-being is being chaired by a female. Out of the 5 presenters, 4 of them are females. Okay, in this graph, it shows that the women labor force participation in the USA between the age 24 and 54 rose from 42% in 1960 to 77.5% in 2020. Meanwhile, the mean participant slightly declined from 97 to 89.2 over the same period, giving the rising number of working women globally a focus women health should be established. This is my main topic, which is the Toward the Effectiveness of Wellness program in promoting women health and well-being, and my name is Shurooq Almarzooq. Imagine walking into a workplace where every woman feels empowered, supported, and ready to tackle the day, just not because of her skills or experience, but because she's backed by a robust wellness program tolerated specifically to her health and well-being. Before we dive into the content, I would like to share a personal story that underscore the profound impact of wellness program on women health in the workplace. As many of you, I'm a physician by my career. As many of you know that the healthcare profession is incredibly demanding, often requiring us to make tough decisions under immense pressure. 2 months back, while I was working as a doctor in a busy hospital, I experienced a loss that profoundly affected my outlook on health and well-being. My father, who had always been my pillar of support. I vividly remember the day it happened. It was November 11th. I was on duty in the emergency room, surrounded by patients and chaos of a hectic hospital environment when I received the call. Despite being trained to remain composed, I felt a wave of emotion hit me like a freight train. In that moment, I realized how little I had prioritized my own well-being amidst the constant urgency of my medical duties. Balancing the demands of work with personal challenges can be overwhelming, particularly for women who often juggle multiple roles. Mom, at work. It was clear to me then that the healthcare system must do some support to mental and emotional health of its staff, especially women who often bear the brunt of their responsibilities. My key points are conceptual tension, role of wellness programs, specific health needs, mental health benefits, and strategies for work-life balance. Starting with conceptual tension, current literature lack a focused examination of how a wellness program uniquely impact women's health. So in the existing theories, there were traditional health theories where general health improvement focus, they don't have addressed women's unique needs. Organizational behavior theories, it examined the workplace dynamic, often overlook gender-specific issues, so that was the gap. In real world, the impact, it would increase the stress and anxiety, it would insufficient mental health support, and there would be barriers to utilize wellness program. So a proposed new framework, it should be integrated gender-specific health challenges, incorporate social determinant, and focus on improving mental health and emotional well-being. Role of wellness programs. Wellness programs serve a dual purpose. They not improve individual health outcome, but also enhance overall organizational success. By focusing a healthier work environment, we can see imposed both productivity and morale. I'm sharing with you a case study with Google Wellness Program. Google is renewed on its comprehensive wellness program, which extremely effective implementation in corporate setting. The key features are the health and wellness facilities. They have flexible work arrangements and support for mental health. The employee assistant to program, EAP, that provide counseling and wellness resources. With that result, it resulted in more commitment to wellness, which improve a higher retention rate of approximately 95%. Within the management position, and the company report that employee participation in wellness program are 50% are less likely to leave the company compared to those who did not engage in the same initiative. For physical fitness and activity, wellness program can effectively care to women's specific health need, promoting physical activity tailored to their circumstances. However, further research need to be to understand which program components are more effective. In this table, these are the from the literature review, or the barriers that could be participant. Like, for example, the time constraint. Around 45% of the women cite lack of time. So solution can give her a flexible scheduling by fitness hours during the work for short activity. Workplace environment, negative perception of fitness. We can do an inclusive culture to promote more regular communication and workplace to build enthusiasm. Cost. 30% of the women avoid activities because of the cost. So we should do unaffordable programs and negotiate sustainable gym, for example, membership or any activities. Lack of access to facilities, around nearly 20% will report this barrier. So we can do as visual fitness, for example. Another barriers are like social and cultural norms. Social pressure may discourage participants, so we can encourage inclusivity, fear of judgment, transportation issues, and education and awareness. Second thing is that the preventive health measures, understanding how social determinant like socioeconomic status affect the effectiveness of wellness program is crucial. Multi-dimensional model that include these factors can enhance the reach of impact of future wellness initiative. Studies that men and women often have different health needs or motivation, and the standard one-size-fits-all program may not be resonated. I'll share a case study. A survey of 2,784 members found that men have higher rate of high cholesterol, diabetic, and smoking, while women will be high stress, lower self-efficiency in maintaining physical activity. So the key finding were that the women generally more likely to engage of overall wellness program, 38%, more than men. They over-reported lower confidence in maintaining fitness level compared to men. So the result is that men and women require different approaches. For instance, providing more flexible, private, and mental health as focused activities for women, while targeting men with more of screening of chronic conditions. Okay, tackling women health challenge. To promote women health effectively, we must adopt a holistic view that encompasses reproductive health, mental wellness, chronic diseases management. Successful initiative often integrate multiple aspects of health to promote comprehensive wellness. In this study, the Mashruf to Women's Health Network provide free preventive health services to understand women, focusing on cervical and breast cancer screening, as well as reproduction education. In this story, the program utilized mobile clinic to reach women in low economic neighborhood, allowing for convenient access to screening and services that are typically difficult to obtain. So what the outcome was, in the first year, the program saw an increase of 50% in breast cancer screening among women more than 40 years. Notably, they reported around 30% increase in cervical cancer screening as well. The program not only provided critical health services, but also utilized the community health workers who were in the same neighborhood, enhancing the trust and encouraging participation. For mental health, women often experience unique mental health challenges such as anxiety and depression, particularly in high-stress professions. A study published in the American Journal of Health Promotion found that employees' participation in wellness program that include a stress management intervention reported 28 reduction in stress level for after 6 months of the course. Participants were more likely to employ coping strategies effective to job-related stress. So wellness program tailored to address these issues can significantly enhance resilience and provide necessary support. Okay, incorporating stress management techniques, for example, yoga, mindfulness, meditation within wellness program has shown significant potential to alleviate stress among women. Do you think there are any additional methods that we can use to better address other than the yoga? However, we need further research to understand which actually a technique which is most effective in various environments. Breast cancer recovery, for women recovering from breast cancer and they are working, wellness program that focus on holistic approach addressing both physical rehabilitation and emotional support are vital. These programs help the women to navigate the unique challenges that may she face during recovery. In evaluating mental health outcomes, developing a theoretical framework for evaluating wellness program is vital. We must identify dimensions specifically relevant to women's health, such as access to mental health resources and impact of job performance. These are the gaps that I've found. There was a gap in focus on immediate benefit, lack of comprehension metrics, and negligence of population. Okay, achieving work-life balance is critically significant for women's health. According to Harvard Business Review, organizations with a strong work-life balance policies can achieve around 25% higher employee retention rate compared to those who do not have this implementation. So supportive workplace policies can also foster flexibility, lead to greater job satisfaction, and improve overall well-being. The part of a flexible work arrangement it has a positive impact on both mental health and job satisfaction for women, balancing various life responsibilities. I have categorized the literature into a subgroup, general difference, age group. Like 65% of millennials prefer flexible work and 50% lower turnover, into cultural and ethnic differences, parental responsibility, geographic variation. For the time constraint, I will just skip. Yeah. Integrating family support system into wellness program can also enhance their effectiveness by including family members and health initiative organization be better addressing unique challenges. I have chosen only two examples, Google organization and Microsoft. In Google, they have over comprehensive family support program designed to help the employee balance between the family and the work. There were on-site children facilities, parental leave policies, and family-oriented events. And at the same setting, the Microsoft had like paid family leave and childcare subsides and support group for parents. The strategies for work-life balance to promote it, implementing effective strategies is essential. For example, flexible scheduling and health competency training for leaders can create a supportive culture. For this, I have categorized them the challenges into resistant to change, inadequate resources, policy, leadership, and cultural and social norms, and inconsistent implementation. Wellness programs significantly influence employee satisfaction and retention. However, it is necessary to establish a framework to understand how different wellness initiatives interact and contribute to these outcomes. According to literature review, I've evaluated as overall resilience on a quantitative data. I'll just read a few lines. It's like most organizations can use participant rate and productivity statistic, missing the full scope of employee. So they incorporate qualitative feedback through open survey questions and focus group. So the outcome will they have rich insight into employee satisfaction. The narrow scope of survey and infrequency of assessment and lack of focus on retention in metrics. While wellness programs are pivotal for promoting wealth, health, and promotion strategy, we must recognize existing theory gaps within current practice. Addressing these gaps will have a better initiative. Recommendation to enhance the effectiveness of wellness program, organizations should implement targeted health education initiative and establish partnership with health professionals to ensure access to preventive services. I can't leave the floor without reflecting on our local experience. Her Highness Sheikh Sabisha bint Ibrahim Al Khalifa support the women advancement in Bahrain by championship the initiative of Supreme Council and raising the royal support for women's empowerment. She highlights the active participation of women in national development, including the healthcare sector through structured program. This was the latest in December 25, where she supported the Bahraini women progress. At the end, addressing the unique challenges faced by women in various professional environments is essential, and promoting overall well-being by investing the post-health initiative organization can foster a healthier, more equitable workplace environment. Thank you.
Thank you very much, Shada.